Welcome to Speaking of Pets.
We're the Novotny sisters from Cleveland, Ohio.
I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist.
And I'm not. I'm Janet Novotny-King, the doctor's sister, podcast co-host, pet owner, rescuer, and lover.
We're here to provide pet owners with science-based information to help them be the best pet parents they can be.
Here's today's episode, created just for you and your pets.
Today, it's all about cats with our cat expert extraordinaire, Dr. Linda Schoenberg. Linda is former owner of Just Cats. She's revolutionary, and she is really a pioneer in a woman-owned, cat-only veterinary practice, and I give her so much credit for that. She's also a PhD immunologist, and as I said, our go-to person for anything about cats, cat health, kittens, senior cats. It's going to be an hour full of fun and information. So even if you don't own a cat, you need to listen in, because I'm telling you, you dog people, you're going to have a cat someday. A cat will find you, and you'll need all this information. So
Can I interject
Dr. Linda
something?
Schoenberg.
Yes.
Let me just interject something. The people who blew me away the most while I actively owned Just Cats were dog owners that said, I could never imagine having a cat in my house. And then a cat somehow got into their lives, and it was like, oh my God, how did I live without a cat in my life? And you can have both a dog and a cat, because the people that feel that dogs and cats can't coexist in this world, and our world is really in big trouble right now, it is true that dogs and cats can love one another, sleep with one another, and it's just unbelievable.
And they groom one another. I think it is so cute. Now, Janet is slowly evolving into that with Libby, the golden retriever, and her sister and brother cats. Aren't you, Janet?
Well, just the girl cat. The boy cat wants nothing to do. No.
Huh. That's weird.
The girl cat, Isabel, they're friends. They're definitely friends.
And the dog is a female?
Yeah. The boy cat, Linda, this is me with the boy cat. He goes like this. He doesn't come near me. He goes near my husband and my sons. I know.
I can't tell you about the XY chromosome versus the XX chromosome, why this male cat only seems to be able to bond with other XYs is news to me. That's very strange. But you know what? Cats write the book. They write the rules.
And
the other thing,
the rules too.
Alice, Dr. Schoenberg is a three-peater.
Yes, and that makes you an honorary co-host, Dr. Schoenberg.
Uh-oh. You mean because this is my third visit with you wonderful ladies?
Yes.
Right. So you and Dr. Rustin Moore, we have to give you like the crowns for the honorary co-host, right, Janet?
Well, on SNL, they give them like a smoking jacket.
Oh, that's right. That's right. Before we get started, I want to see Linda's sweater, and I hear matching slippers.
Bring it on, Linda.
Okay.
For all you cat lovers out there.
This is an old,
you too could have
an old sweater, but I love it, and it's so appropriate.
Yes.
It makes me want to go like this, like a cat.
Not like this.
Right.
And these are the slippers that a friend of mine got for me. And I guess they said they can be washable. They're washable because there was some discoloration on the bottom here. And I was, just for the heck of it, I went on Amazon to see if they had them. And even though these say on the bottom, oh so comfy, when you Google that on Amazon, it says oh so comfy, but it has two other brands, the exact same slipper. And I think they were $12.
There you go.
Cheap. And they're quite comfortable and comfy,
like
cozy.
Little cat paws.
Yeah.
Well, they've got little things on the bottom.
So the stickies.
So that, you don't slip.
Linda, you have a big foot.
6.5, 7.5. That's
because 38-39 is like what I wear. I'm a 10.
38-39 European is a 7 or 8.
Yeah. Oh, okay. I'm like a 40 then, or a 42, or it's a big one.
Whatever.
Well,
you don't go by the size, you go by the fit.
I agree.
The fit is only a number, or size is only a number. Now, Speaking of dogs and cats getting along, if I decide I have two Goldens, okay, 4 and 5 years old, and Janet has Libby, who's about the same age, how would I go about bringing a kitten into the household, Dr. Schoenberg? What are your tips for that?
I think it's kind of like when you bring a new baby into a house. If the dog is really bonded to one individual, I would have another person hold the kitten while you come into the room and greet your dogs and, oh, nice puppy, and sit down, and then maybe transfer the kitten into your lap and see how, if the dog approaches, you pet the dog, nice doggy. This is the kitty. This is whatever you name your kitty. And they'll probably sniff. And hopefully, if the kitten is, I've never done this. I'm just telling you what my mind tells me we should do. Just let them sniff each other, and hopefully the cat's not going to freak out, and the dog certainly shouldn't freak out because it's this tiny thing, and it might even think it's a funny looking puppy.
Mm-hmm.
And so I would make sure that the kitten is protected during the first couple of meetings, or I don't know how many days it might take. But then, kind of like when you get a second cat into a household, I would put the kitten in a cage so that the dog can get up close and sniff it.
Yeah.
And then, make sure the kitten has time to navigate the house and where its litter box is, where the food and water is. And then, of course, you also have to be in a position to make sure that the dogs are not eating the kitten's food or drinking all the water. So it has to be in places that are in a way protected, or food goes down when they're done eating, it gets picked up.
Mm-hmm. Good point. And it's not that cat food is harmful to dogs. It's just that it's higher in fat and protein, and it might be, cause pancreatitis or give the dog diarrhea.
And the cat needs to have its food.
Right. And besides that,
and just like in multi-cat households, there are some cats that are pigs
yeah.
and will eat up everybody's leftovers. And so you have one cat that is grossly overweight, and other cats that might not be at ideal weight because they're grazers. Canned food in some instances will offset that problem, because I believe that many more cats will eat a portion of canned food rather than with dry food, where they graze and then they walk away, come back, eat a little bit more. And if you have a dog or another cat that likes that food, it'll be gone.
Yeah.
So that's what you've got to take care of.
Should you pick up the food after they eat for cats or not? I mean, assuming there's not a dog in the household, what's your opinion on that?
If it's a multi-cat household,
Uh-huh.
you might need to do that if the other cat finishes off the food. If it's a single cat household, it's safe to leave out, well, certainly dry food is safe out to leave. It's okay to leave out all the time.
Mhm.
Canned food, it's not going to go bad after a couple of hours, but I think, prefer to decide on a portion that the cat will eat, and then the next time you feed it, you give it another part of a can.
Yeah.
Or if it's one of these 3-ounce cans, they might eat a whole can. It just depends on how big the cat is and the caloric requirements.
I used to leave my dry food out for grazing. Janet, what do you do with your two?
Ours is, we leave it out, the dry food, and the cats come and go, and they also dine al fresco.
But you put your food up so that
because of the
can't
dog.
get to it.
Oh, I'll be in the other room and I'll hear it. And I know Libby, the dog, got into it. So no, it's right now it's up. It's always up high, and they have a private space where she can't go.
Well, and you have big dogs. And so
Yeah,
the point is that if you've got a golden or a big dog, they'll just put their paws on your countertop and they'll lick off everything. So you've got to be very mindful of exactly where you're going to put the food so that the dogs don't have the ability to eat it.
Hope you're enjoying today's Speaking of Pets podcast. Every week, we feature a board-certified specialist, dermatology, me, oncology, internal medicine, orthopedic surgery, ophthalmology, dentistry, you name it. If it affects pets, we're on it.
We're here to share some really good information for pet owners, practical information that is science-based, so that you can be a pet owner and have a healthier pet.
To learn more about your pet's health, check out our other episodes wherever you get your podcasts.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So my family's decided we're going to get a kitten.
Get
So we're going
two.
to go.
Get two.
No, I'm a family, and we've decided we're going to go get a kitten. So what do? We're going to go to the rescue place. How do you know, like, which kitten? And should you get 2, 3, or 4?
You want to become a cataholic?
And be catatonic.
So, I mean, I always used to tell my clients that according to everybody that does behavior in cats, cats are solo creatures. Believe it or not, they really like to be by themselves. You talk to my clients and they say, what? My cats love one another. They could not exist without having other cats in the household. So what people are experiencing and what is supposedly the truth about cat behavior don't sync. Okay. So I think what you've got, and they also say, well, if you're going to get another cat, so there are 2 cats. So they theoretically could bond, because once you introduce a third cat, there's always an odd cat out.
Yeah.
And so 2 of them will bond and 1 of them will be ostracized. Whether the cat even cares, who knows? But you don't want to create more anxiety and stress in a household than you need to.
The
And
reason
when
I
you go
think
to one of these wonderful shelters,
yes,
I think what I heard most from my clients, because the cats that came into my life were either hanging around somebody's home and they couldn't take it in, or we had a client who had found 2 what looked like Siamese mixed females down by Case Western, and they bred it with a purebred seal point somewhere east of Cleveland. And she had wonderful cats, and my daughter went there, and she was a little kid, and she picked out this kitten who turned out to be the best thing that ever happened to me. And I'll tell you about him in a second. But anyway, I think when you go to one of these rescue places, there are cats that are they'll come to the cage and they want to interact with you, and they'll, put their head like that for you to pet them. And they may even give you kisses. And the staff there certainly knows which cats are the very friendly, outgoing, social cats. And those are the ones that will get chosen. So my Einstein. That was what my daughter named.
Aw.
Einstein.
My daughter named this cat Einstein, and he was a lynx point, which means they have an M on their forehead, okay, and the stripes. A snowshoe, meaning he has white feet, Siamese.
Oh.
Okay. And he used to follow the sun around all the beds in my upstairs. And when I would come home from work, even though he was her cat, he bonded with me. And I would go, Einstein, meow. And I'd hear thud. That was him jumping off the bed. And then you would hear him go, coming downstairs. And then I would lean forward and put my palms on my thighs, and I go, Einstein. And he would hop onto my thighs, into my hands. Then I'd lift him up to my head and I said, give me kisses. And he would kiss me on my father wanted to vomit.
Who cares?
It was crazy.
Yeah.
Every single one of my cats, except for the very last one that I owned, somehow decided to sleep between my feet under the sheet. And
Wow.
isn't that weird? I never
Yeah.
invited them. I never encouraged them to do that. It's just that I don't know, at nighttime they maybe felt it was a safe place to hang out.
I've always heard clients have always told me that Siamese cats love fabric and they love to like go in your sweater drawer or under the sheets, kind of like dachshunds like to do,
Huh.
But
All I know is that my giant schnauzer, when my husband used to be on the road traveling for his job, we have a king size bed, and he used to come up and lay on not only my husband's half of the bed, but he would be kind of at an angle. And I would take my foot and push him over, and he'd go, "Arr." But that was it.
I'm curious, how old did Einstein live to be?
Not quite 10, because like many Siamese cats,
Okay.
Yeah.
genetically, they have a predisposition for getting intestinal cancer.
Yeah.
Oh.
And he had high-grade lymphoblastoma.
Yeah. Linda, I lost my last cat, little K, to he was intestinal cancer. He was 13 and a half, I believe. And I noticed his abdomen enlarging, and I had an appointment at the internal medicine specialist. This was like a Thursday, and she was getting me in Saturday. And the next day, his stomach got even bigger. And that night, he just died in his sleep. And so I ended up aspirating some of the fluid because I had to know. And it was full of
Cancer cells.
mesothelioma cells. I mean, he was just full of cancer, but it was that fast. And he really had no symptoms prior to that. Oh, he'd throw up occasionally, like maybe once every 4 months. And when he'd throw up, it was, usually hairball or maybe a little bit of bile, but he really kept it a secret, if you will. But then again,
that's the story of cats.
Yeah.
Cats hide
Yes.
symptoms of disease until they have 3.5 legs in the grave, is what I used to tell clients.
Yeah.
They mask it so amazingly well.
Yeah.
And I mean, and the crazy thing with Einstein was that he responded really well to the chemo.
Oh.
And in the 2-week period between the end of the injectable chemo, it came back with a passion. It was terrible. And this is not quality of life. And one of the hardest things as a veterinarian that we do is having these discussions with they're not owners anymore, our pet parents, right? About quality of life for not only the pet parent, but for the patient.
Yeah.
Because unlike people who don't have a choice unless they live in Oregon or go to Europe, when the time is right, they should be able to go with dignity and not have to suffer. The worst thing, I've had so many clients throughout my career that said to me when it was all over, I wish I didn't wait so long.
I would agree with you. I agree. But and the other thing is, I think the pet parent needs to know they've done everything they can. How can I don't want to say within reason. My philosophy is just because you can do something doesn't mean you should.
Correct.
I always ask, whether it's my own medical situation or a pet, is this procedure, which isn't an easy procedure, going to make a difference in how I treat this patient or myself? Because this procedure is not without risks. And if it's not going to give me information, I say, then let's not do it.
Right.
Yeah.
And people, so veterinary medicine has for ages, I think it's fair to say, undercharged for the amount of service and quality of service that is provided. Now that's changing, and practices are trying to charge a more equitable fee so that their employees can get paid a decent wage,
Mhm.
and it's a for-profit business. It's not, people say, but you love animals, so why aren't you just giving it away? Because you can't just
Yeah.
give it away. But for people who don't have the money, I think it's so important to say to them, it's okay. It's okay, because look at how far this pet has gone.
Mhm.
You've been such a good parent for all these years. Look
Yeah.
look at the fine job that you've done. And if whoever upstairs makes the decision that things are changing and not for the better, you can just say, I accept it, but I want my cat or dog
Yeah.
not to suffer.
Yeah. I totally agree with that. The other sad thing that just like you, we help out rescues, and you see these kittens with these horrible viral herpes facial. I mean, the eye infections are so bad that sometimes they have to have their eye out.
Oh my God.
What is your advice? Say someone adopts a kitten from the shelter, and you know how contagious this herpes virus is, and they bring the kitten to you. What can be done about that?
Well, hopefully the shelters are being more responsible in testing and medicating before releasing pets that have these issues,
Mhm.
because and you also, if you're going to be using certain eye medications, they are not cheap, and they're not always readily available. And is it the responsibility of the shelter or whatever agency it is that is trying to rehome these to provide the medical care for these pets as part of the deal?
Yes.
Or they need to wait, if in fact, and the question is, herpes is the gift that keeps on giving. It will go undercover, and when there's stress in the household, it will reemerge, just like people with fever blisters.
Yeah.
They're there
Huh.
they're always there. And
Yeah.
when a human being gets stressed out, their fever blisters can reemerge.
And I think shelter medicine has come a long way.
Yes.
Back in the day, when you graduated vet school and what are you going to do? Oh, I'm going to work in the shelter. It was kind of like, oh, I'm going to work in the shelter. Now it's so vital that, we're getting these rescued animals are hit by cars and the policemen bring them in, and shelter medicine is like ER times 1,000, because
Wow.
there's no money there. You have to stabilize these pets. It's tough.
Right.
It's a big thinking on your feet type specialty of our profession.
Way back in the day, I think when a physical exam was performed on any age pet, I don't know what a lot of veterinarians did, but if they don't look at the inside of the eye, look at the retina, look for things open up the mouth, flip the lip, look at the teeth, palpate the abdomen, always palpate the neck to feel for thyroid tumors. Even if a cat is young, it's amazing the number of cats that you palpate that can have a little thyroid blip.
Yeah.
And
Huh.
I can't remember how many people would come into the practice, and especially when I opened up the mouth. That was never done on my cat before.
I know. Or can I say this? Look at the butt. And I'd always explain to the owner, even though I did derm, we'd flip the cat around and I'd look under that tail.
And if something was waving at you,
Yes.
yeah,
hello,
right.
tapeworm.
and especially with cat allergies, a lot of times that rectal area was so inflamed, and they're rubbing their butt just like dogs do with their anal glands. So I agree with you. A thorough physical exam isn't stressed enough.
Right.
Right away, they want to go to CAT scan or MRI. You got to put the animal under anesthesia for that. Not everyone makes it out of anesthesia. A good physical exam is worth its weight in gold.
And since you had a specialty in derm, we had a very, very fine flea comb, and I was called the finger of the flea. I am determined. If I had a feeling And you can have a feeling about every cat because
Yeah.
it's not a bad feeling to comb and comb and comb and comb and comb and comb. And oh my God, one flea.
And that's all it takes.
That's all it takes. And they said, oh my God. And I said, well, I'm Dr. Flea, you know,
Yeah.
because it is so crucial. And a lot of people don't have the patience to be thorough. And the other thing which is changing is the recommendation, and it depends on the practice, to do blood work.
Right.
Even though it can be expensive. But what's the value of blood work? Because there are times when you can pick up a problem early on, or if you do it every year at
Mm.
once they get to be a certain age, you
What
get
age
to
do
see
you
trends.
advise to
Well,
start doing blood work?
they so at Just Cats, I believe the age is 7 at
Okay.
now.
Oh,
But even when they are younger and coming in, it is not like 5. Especially so any animal that's undergoing anesthesia for a dental, or if they have a little growth or something, they should have blood work done. And then my feeling is, I'm just saying to my client, we are now starting, we can have something we can compare.
Right.
We have a baseline.
Right.
And if it changes, then we know something is cooking and we need to figure out what it is that's going on.
Now, when you're talking about the thyroid nodule, what age do veterinarians need to check on that? Like what a cat parent should say to the vet, hey, would you check on that for me? Well, they shouldn't have to ask. Okay, first of all, but what age do you normally see a thyroid problem, and what is the thyroid problem in cats?
Okay, so in the late 90s, I believe, all of a sudden they were finding many cats that were eating like there was no tomorrow and losing weight. Every woman's dream.
Yeah.
And you don't have to work out, you just eat and the weight just comes off of you. And what they found was that cats get a condition called hyperthyroidism. It is a benign, which means kindly, it's not malignant. Hyperplasia, which means an increased number of cells
Okay.
of the thyroid. Now, in the body, you have pituitary, the master gland in your brain. And the pituitary regulates a number of different hormone syntheses that go on in your adrenal glands, in your reproductive system, in your thyroid. And what comes out of your pituitary is a stimulating hormone. So it's called TSH, thyroid stimulating hormone. There's also a feedback mechanism that when the thyroid hormone level is appropriate, it shuts down the cells that make the stimulating hormone. That's what keeps everything in check until the thyroid has an issue. And the issue is that regardless of what's happening, the thyroid stimulating hormone is still getting pushed out and making the basal metabolic rate of the cat go up, makes the appetite go up. It also can cause some muscle wasting, and it can affect the kidneys by causing the kidneys to have an increased filtration rate, and it can mask underlying kidney disease. And it was so prolific. And until things really made it into the journals, and not every veterinarian read their Journal of the American Veterinary Medical Association, cats were being euthanized because, oh my God, your cat is losing all this weight. And guess what? It's not leukemia positive. That was always the big killer until we got leukemia vaccine. And if your hands were not super accustomed to palpating an abdomen and reaching up all the way up and feeling for 2 kidneys that were more or less the appropriate size, and going down the intestine and not feeling a big lump there that wasn't a soft bladder or something like that, they were missing cancers. Okay. But the thyroid, in my opinion, the more frequently we have the opportunity to go down the side of the neck and feel for whatever, the better off we are. Because there were many, many times that I would feel a thyroid slip, is the way they're
Okay.
referred to as, and the value of the thyroid was still normal.
Hmm.
And so what you need to do is you need to put it together. And first of all, you've got to weigh the patient, the patient. Every time a cat or dog is seen, they should be weighed, because they do not determine that they're not going to look good in a bathing suit this summer
Right.
and lose weight. What is if their parents don't feed them, obviously they'll lose weight. But if they're getting the same amount of food that they're accustomed to getting, and all of a sudden the weight drops, you know there is
Something's wrong.
something wrong. And in a cat, the most common thing, and we typically see it when they're 8 and above. The
Mm.
older they get, the greater the risk of developing hyperthyroidism is. And so that's why you should always feel it. Better, you should learn how to feel a little blip that it's not active,
Yeah.
than not feel it and wait until it's already causing problems.
So
Wow.
then do they get how do they diagnose that the thyroid is off? They feel the lump, but then
They do a T4.
a
blood
blood
work.
test.
Part of a senior blood panel
Okay.
consists of a chem screen, a complete blood count and differential, and a thyroid.
Okay.
It's called
Hey,
a
I got that
total
right.
T4.
What,
I
Jen?
got that right. Blood work.
Yay.
Yay
So
me.
then how do they treat that?
So
That's what I want to know.
okay. So there are
Going to involve a pill.
a number of different ways in which it can be treated. The gold standard is when it's not just slightly elevated, but it's a decent amount, they do what's called radioactive iodine. So they give an injection of radioactive iodine, and wherever there is thyroid tissue, it will suck it up and it'll kill the cells. And it's never where typically the cats don't become hypothyroid and need to get thyroxine supplementation.
Mm.
Now,
Hmm.
when I say it goes everywhere, because interestingly enough, thyroid tissue, even though it's supposed to be right up here, sometimes migrates. And it
Mhm.
could be found in other parts of the body, which is why this particular form of therapy is really, really good. But it's over $1,000. And
wow.
and the cats stay at a facility that administers the medication for, it used to be 5 days, it might be 3 days now.
Mm.
And after that, when the cat comes home, they say, do not let the cat sleep over your neck, because
Right.
the radioactivity can affect their pet parents. They don't want them sleeping over your genitals, because if you're still, thinking on having families, you don't want to
Yeah.
have anything mutated because of the radiation that's there. And the radioactive material comes out of the cat's body for, I believe it's a good 4 weeks post-treatment. So every time you clean the litter box, you need to put and hopefully you're using clumping litter.
Yeah.
You're putting all of the urine balls, all of the stool into a garbage can that is kept in your garage. And then it sits there for a total of 3 months. And then the radioactivity has declined, so that when the garbage men pick it up and take it off to wherever the garbage goes, they have radioactive scanners at the dump sites.
Really?
And if they get a buzz, they're going to find the garbage, and then they're going to come after the person who did it.
Wow, I had no idea about that.
Yeah, so that's the gold standard is
Okay.
radioactive iodine. Okay, so the other way,
If I can't afford that, what's my option? Other option.
okay, so the other option is a drug called methimazole, which blocks the combining site on the thyroid cell, so it refuses to let the thyroxine get in and make that cell work hard. Okay, now, very rarely there can be some problems with methimazole, and cats can develop an autoimmune hemolytic anemia. I had one patient in all of my career that developed that.
Okay. So it's not
Oh.
real common.
not
No.
real common. But you need to tell people to be on the lookout for some bleeding. And the other thing with the medication is that you have to find the right dose. There is no perfect way of determining that, given when you get the total T4. It could be sky high, it could be a little bit over the normal range, and you want to start off with a small dose, give it for maybe 3 weeks, have the owner come back in, and we repeat the T4, and we also look at a renal panel. Why?
Kidneys.
Because, as I said, that thyroid and kidneys coexist. The higher your thyroid output, the more it can mask underlying kidney disease. And as the thyroid comes down, the kidney values can get worse. So you have to be careful. Under ideal circumstances, you would like to have your total T4 to be at the high end of normal, so as to cause fewer problems with the kidneys than all the way down where it's very, very suppressed.
And this
Okay.
medication is for life. You don't just put them on it for a couple of weeks. It's there.
Correct. It's forever.
Okay.
Now, they do make a transdermal methimazole. So you put it on the inside, you have to wear gloves.
Yep.
And when you give the pill, you're supposed to wear gloves.
Gloves.
Yep. But you put it on the inside of the ear. It's got to be given just like the pills twice a day. So you alternate ears, and then you've got to wipe the residue of the stuff, because there's a gel, a base that it's put in. You want to make sure that the skin is clean so that when you apply the next dose, it gets
goes in.
absorbed. Yeah. And so that's the pill.
Hope you're enjoying today's Speaking of Pets podcast. Every week we feature a board-certified specialist, dermatology, me, oncology, internal medicine, orthopedic surgery, ophthalmology, dentistry, you name it. If it affects pets, we're on it.
We're here to share some really good information for pet owners, practical information that is science-based, so that you can be a pet owner and have a healthier pet.
To learn more about your pet's health, check out our other episodes wherever you get your podcasts.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
Now, what is also interesting is that Hills, I don't even know at this point how many years ago, developed a food that is called,
YD.
yes, thank you.
I don't know. Why is it called YD?
Because TD was the tooth diet, so they couldn't use it for
Oh.
thyroid.
So it's a yummy diet.
We'll just take Y. Okay.
Right.
It's yummy.
So
Yummy diet.
YD comes in dry and canned. There are many veterinarians who will not use it no matter what. They
And I
don't.
don't understand that. I love to control a disease with diet.
Me too. And even though the canned version was never totally loved by cats, the dry was better accepted by many cats. And so it's just like when we had cats that were allergic to a protein.
Yeah.
So there are a whole lot of novel protein diets available. And one of the common ones was venison. Well, there was venison, there was rabbit, and there was duck.
Duck.
And
then
what was
ZD, the
was
chicken.
there a fourth one?
There was venison, rabbit, duck, and then there was ZD, which was
Okay, yeah.
centralized. Yeah.
But anyway, so I was fortunate enough to be invited to a meeting, and it was out west, and it was at one of these ski resorts, but it was held when it was summertime.
Mhm.
And it was, I think, Royal Canin who had sponsored it. And I'm looking across the shelf, and there was a food that was the preferred version of all of the duck diets that we use. My belief was, if they make it for a cat, I need to have it available, because cats are weird.
Yeah.
They could eat somebody's duck and reject somebody else's duck.
And in
Okay,
3 days, they'll eat something and not want to eat it after on day 4. Right.
and so who's going to make the choice as to what diet they're going to eat?
Yeah.
Not me,
Yeah.
not you. The cat is
Mhm.
making the decision. And I said to somebody, why did why did they get rid of it? Oh, because it wasn't selling a
Right.
lot. And I would say to a vet who was in a situation, I said, did you ever try this food? Oh, no, we didn't have enough room on our shelves to keep that one around. So even if it would have been the ideal food, it got dumped
Yeah.
because the veterinarian made the choice as to what foods
Yeah.
he or she was going to sell. So anyway, the YD, the dry food, I would tell somebody, look, put a little bit down one day. If the cat eats it, put a little bit more down the next day, see if the cat eats it, and continue doing that. And if you find that the cat likes it, the problem is that is the only food the cat can eat. Why? Because there is iodine in practically everything else in the world. So if it's chicken, it's got iodine. If it's beef, it's got iodine. If it's whatever, it has iodine. And it's got to be iodine free in order for it to work. So not me, but a lot of people make decisions. Oh my God, my cat couldn't just eat on just one food. He would hate it. Well, ask that of your cat, and that's not true.
Yeah.
If the cat likes the food, he's not going to say, well, what am I getting for my other choice? That's not even part of the game plan for them. And what's beautiful about the YD is that, unlike the pills, it has a saving effect on the kidney function.
Mhm.
It is gentler on the kidneys than the methimazole.
Mhm.
And anything you can do that, and the other thing, the beauty is, if the cat's eating the food, you don't have to give it a pill.
Right.
You don't have to rub medicine on the ear. It's a done deal.
Or send
It's-
it for radiation. And as far as tips for changing foods for a cat, I always told my pet parents, don't put this, whatever food you're going to do, let's say YD, don't put YD down today after abruptly. And you have to gradually, because they look at it and say, what's that new food? What is that? I don't like it. You have to gradually go into it.
But I would offer it to them also before you give them their regular food, because if they're hungry,
Yeah.
they
Yeah.
might be more willing to try
I
it. And,
agree.
it's just a little bit that
You
you're
take
offering them.
advantage of them being hungry. I agree. But having said that, you can't let a cat not eat. Like
Oh.
with dogs, you can say, you don't like that, you'll eat it in 2 days. You can't do that. And why can't you do that with a cat?
You can't starve a cat because they will get hepatic lipidosis, which is a very nasty disease where fat infiltrates the liver and you have major problems.
Mm.
You could never make a cat do anything that it does not want to do. And if you think you're going to make a cat eat a food by not feeding it anything else, you're creating the biggest crime of your life towards your pet.
Yeah.
Because they don't respond that way. They would rather die and not eat food that they don't like.
And
They
then
don't know that they're dying, but that's what happens.
the longer they don't eat, then that fatty liver, that hepatic lipidosis sets in. That makes them sick to their stomach. They don't want to eat. So it just snowballs.
Right. Right.
Now, Janet has her cats on Live Clear because she has allergic humans that live in her house.
And Live Clear prevents the dander antigen from
40%
forming?
reduces the
works.
allergenicity of the cat to her
It
husband
works.
and sons.
It works.
Did you ever try the first thing that was out to do that? The when your kids, when they were kittens, to take a couple of liters of distilled water and pouring it over your cat? You know this, don't you? So
There's
they
no
No, I've
way.
not heard that.
they used to recommend, if there were people who were allergic in a household when they first introduced a kitten, so that the first week you would take the water, pour it over the cat, and then there's in a little container, you know, a little basket, whatever, and then put the water again and keep doing it for a couple of times. What that does is it elutes, which means to remove, the feline dander antigen from the kitty's fur. And you use new water each time, each day, not every time you do it, but if you're going to do it 3 times a week or whatever, you use a fresh gallon of water or liter of water to do it. And then after, I think it was, and I think somebody, a human, maybe somebody at the VA, I mean, this goes back a long time,
Yeah,
was
yeah.
the one who talked about this.
Yeah.
After maybe a month of doing it a number of times a week, you can go to once a week.
Huh.
And maybe even after that, you only need to do once a month, because it's the feline dander antigen
Right.
to which we are allergic. And if we can get it off their fur, then it's not going to get into the air. It's very sticky. It's not going to get onto the furniture, onto the walls, and onto the carpeting, and blah, blah, blah. And so this is a nice thing that this particular food has that option.
I
Yeah,
think we should
it
wash
does.
the humans. I think we should wash the humans with distilled water.
Well, I don't think that we have, there's other stuff that's much worse than feline dander antigen that we are allergic to.
But
I mean, people are constantly have drippy noses and they
Yeah.
just say, I'm allergic 24/7, 365 days a
I
year.
agree, and they make it up. But this cat food has worked wonders. It's unbelievable.
Okay. Thank you for teaching me something new.
Yeah, well, and the
Oh,
cats
and
love it.
Janet, also tell her about the hydration liquid you're using.
Oh, so we had another vet on, Alice. I can't remember which one, but talked about how cats don't get enough water, and so there's
That's
this.
Debbie Greco.
So then she told us about this packet. I don't remember who makes it, Alice. It
Purina.
tastes Purina. It tastes like liver, and you put it in the bowl. Well, when I put that out, it's like I put out a martini.
That's my drink.
Not
And
for
who-
me. Those cats are like,
Janet,
that-
there was just a study that was published that said instead of giving sub-Q fluids for a moderately dehydrated cat, that supplement was just as good.
it's amazing, and it doesn't smell that bad. It's not as bad as
Hydrocare or something like that.
Hydrocare, but it's not. It's pricey. Let's put it that way.
Okay.
And it says
So
to
now
give, like,
how old is this cat?
our cats are they're going to be 5 in April.
So I guess the question is, and this is a hard thing to figure out, although I think maybe there could be a way, but it's probably not worth it. So cats that eat a lot of canned food
Right.
get so much more moisture
Right.
in their bodies than cats that do dry food.
Mhm.
So I'm sure there are people who are feeding canned foods who never see their cats drinking out of
Right.
the water dish. And then the next question would be, if you would maybe to look at it scientifically, if you do a specific gravity of the cat's urine
Mhm.
before you introduce this hydrocare, if that's what it's called,
I think it's called.
Hydrocare.
and then do a specific gravity. And what specific gravity is it's a physical chemical term that looks at the concentration of a solution. And the thing in urine that is responsible for that number is urea, which is a breakdown
Right.
product of protein. Okay. So that being said, if this additive affects the specific gravity of the urine and makes it, first of all, if the specific gravity is normal, should we even bother to supplement?
True.
Um,
True.
And if it's not normal and we need them to drink more water, then obviously it would be inappropriate supplement.
I'll tell you what the cutest thing is we have, you know, when you get out of the tub, you have like a bath mat. It's like a towel, heavy towel thing.
Sure.
So after you take a shower, you go back in there to get dressed or whatever you're doing, and you'll see little footprints on that because they've gone into the wet tub
To lick the water.
to lick the water. And every day we get those little footprints.
There are cats that will sit by your sink waiting for you to turn on the cold water faucet to a drip because they want fresh running water.
I love those little fountains you can buy.
But people have to keep them clean.
Yes.
That is the biggest dilemma with those fountains, is
Good
that
point.
mold and other kind of stuff
Oh.
can build up if they're not cleaned. And I just read on Wirecutter, which is the New
I
York
love
Times,
Wirecutter.
okay,
Big fan.
about humidifiers.
Yes,
Oh,
we yes.
absolutely.
I have a humidifier in my
do too.
bedroom because I live in a 100-year-old house and we have radiators and it gets
And it's
very
dry.
dry. And I couldn't believe when I mean, I take it off all the time to fill it up. And I know there's, you know, like calcium or some kind of crusty white stuff there that is hard to, remove.
Yeah.
But, you know, I took soap and water and that's what they recommended, soap and water, and wash it out and blah, blah, blah.
I use white
Okay.
vinegar.
Okay. Yes. Any
And I
acid
wash
should
ours
do it.
every single week, but I was going to tell you, the cat will put her face where the moisture comes out,
Really?
like a little facial.
Really?
A cold water facial.
Yeah, she loves it. The
Yeah.
girl cat, not the boy cat. The girl cat will. She kind of like,
I just think humidifiers and jetted tubs are like a mold factory waiting to happen.
well, I wash our humidifier because we only use it in the winter because it's so dry.
Right,
I
right.
wash it every week and we change that paper filter
Yeah.
every week. I order them by the case.
Yeah, mine doesn't have a. This is a little small thing that sits up
Yeah,
on
I
a
have the one
dresser.
Wirecutter told me to get,
Oh,
whatever it is.
okay. But mine
love
doesn't have a
Wirecutter.
filter. But anyway, yes, I find Wirecutter very
Love Wirecutter.
You
interesting.
too. Well, Janet, we need to wrap it up, but I
I
want to ask
know, I
Linda.
know. There's so much to talk about. We
I know,
love
but
having
Linda,
Linda on.
what are your, do you have any final advice for someone who wants to adopt an adult cat from a shelter?
Aw.
Because God knows those poor adult, nobody wants an adult cat.
Nobody
That one
wants the
kitten.
older ones.
Okay,
I
so
love the adult cat.
so here's the dilemma. Owners don't always tell the truth. Pet parents don't always tell the truth. And
People
that
don't
being
always tell the
said,
truth.
that's true. They can relinquish a pet because, oh, my child suddenly became allergic.
Yeah.
Oh, we're
Mm.
moving. Oh, whatever. But if the cat has a behavioral issue, they're not going to say, oh, my cat pees on the bed, or my cat scratches the furniture, or whatever it is. They will not reveal that because it's a no-brainer. Nobody's going to want to adopt a cat that has a behavioral problem. So I think the question is, the first thing you do is you see how friendly the cat is with you. And
Sure.
then I don't know whether the shelters have any kind of policy where if you say, I will take the cat on condition,
Mhm.
I will keep it for a minimum of, you name the number of weeks,
Mhm.
because I don't know whether 2 weeks is enough or 4
Right.
weeks is enough. And
Yeah.
if in this time period, this cat does not adjust to living in my house, I have the right to return it,
Yeah.
because
Yeah.
you don't want to make pet parents unhappy, and you don't want to subject a cat or a dog to abuse because it's doing
Right.
something that it's been doing for years that the previous owners were unable to deal with.
Well, and the sad part is too, if they adopt the cat and it's not working out, they may be too embarrassed to take it back to the
Yes.
shelter, and then they just abandon it.
Right.
And that's so sad.
That is,
The
that's
worst.
pitiful. Yes, that's worse. Because,
That's worse.
and I also encourage people, if they can, to keep their cats indoors. We're
Mhm.
not Europe, we're not Great
Guilty.
Britain, where they
Yeah.
believe in letting them out,
Right.
because all of the things that they can get into are horrifying. A friend of mine said she was she lives up near Salm and Wilson Mills, and they heard this incredible, crazy sound the other night. And they looked out, and there were coyotes.
Oh yeah, we have them too. Yeah.
Okay. And I said, and a puppy or a dog or a
Yeah.
cat or a kitten, they're fair game. They don't have a problem eating them. So I really encourage people to give their animals, their pets, a lot of love
Right.
and try to find activities that are safe to do inside the house. And I love the cat dancer because they can't swallow it. They
Right.
can. My cat used to pick up the wire in his mouth, bring it on top of the bed, lie on it so that the thing would arc around, and then he'd try to kill it with his hind legs. So, I mean, you can find things to engage your pets so that they get some physical activity and some interaction. They always say if you're going to use one of these lights,
Laser.
lasers.
Laser.
Yeah.
that and if your pet, does what it's supposed to do with it, always give it a reward at the
Right.
end.
Oh,
It's important to reward them for doing what they need to do.
Right. Because if they catch the laser point, they need a reward. They need some satisfaction. You're
Correct.
right.
Correct.
Wow. Well, Janet,
we got to wrap it up.
did you learn something today?
I always do.
Too. I do too. I love talking to Dr. Schoenberg. I always get really good tips. And the explanation of hyperthyroidism, I think, is excellent because
Thank you.
any pet parent with a cat 8 years and older needs to keep their eye out for that.
Any cat that's eating and losing weight
Yes.
Yeah.
has a problem.
Yes. Even
And
though as
sometimes they
women,
will
we like
howl
that.
at night because it causes hypertension.
Yes.
Yeah.
So
Well, thank you so much. And
it's
I
my
hope
pleasure.
hope it warms up in Cleveland.
Well, thank you, Dr. Schoenberg. Janet, thank you as always. And
Pleasure.
everyone out there, give your cats a nice big hug and kiss. They're just wonderful to have around. And listen, they do us a lot of favors. They see a lot of little rodents that are in the home that shouldn't be there.
That's their
But not
job.
all of them want to kill them.
No, that's true. It's a fun
That's
play
part of the
toy.
interview process when we get kittens. Are you killers? You're in. Thank you so much. Always a pleasure. Don't forget
Okay, well,
to like us, share us, and follow us. We appreciate you. Thanks for listening.
Thanks. Bye-bye, everyone.
bye-bye.
Hey, thanks for watching.
And listening.
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
And give your pets a big kiss from the Novotny sisters.
The Speaking of Pets podcast is an SLA Video Production.